Performing an arterial blood gas sample is something that most candidates will have done on a daily basis in the ED. Despite your familiarity with this topic, it is important that you're as complete as possible in the exam. It is essential, as with all procedures, to ensure that you introduce yourself, explain the procedure fully, and obtain verbal consent. It is also essential that in all procedures, universal precautions are undertaken. These include gowns, gloves, eye goggles, and hand washing.
Before we undertake a blood gas sample from a radial artery, we undertake an Allen's test. In this, the patient first of all makes a tight grip in order to squeeze blood out of the surface capillaries, and then we apply pressure both to the ulnar and to the radial arteries. And once we've done that, we then ask the patient to open the hand. Okay, and we see that there's no blood in the capillaries. We then release the ulnar artery to see the blood coming back, to check that the ulnar artery is patent, as demonstrated here. Having slightly extended the wrist with something placed beneath the wrist, we then clean the area around the radial artery with a suitable disinfectant, betadine or spirit, and then we should infiltrate with a local anaesthetic. So we use a small gauge needle, and what we're aiming to do is we feel over the radial artery till we can feel the radial pulse, and then we raise a small bleb of anaesthetic just underneath the skin over the radial artery. We then give that 2 to 3 minutes to take effect before we proceed to our radial artery sample. Some blood gas syringes come ready heparinized, and with one of these we need to roll the heparin around first of all and then expel any surplus before placing a needle, and a blue needle is the preferred size. Use the fingers of the left hand to judge where the artery is, and then aiming for the artery. And we aspirate arterial blood to the required volume. We then remove the needle while placing firm pressure over the artery, and then ask an assistant to hold over the radial artery with firm pressure for 3 minutes to avoid a hematoma. Having withdrawn the needle from the patient, for protection, we place the needle in the rubber bung. We then remove the needle from the blood gas syringe. Use this device with the filter at the end in order to expel any air, so that we've got blood right up to the tip of the syringe, and then we dispose of the needle in the sharp spin and take the sample to be analysed in the blood gas machine.